Hi dear students, welcome to the class of Kids Covery. Myself Dr. Parv and we are discussing Pediatrics. And in this topic of discussion today we will be starting Orthopedics topic, that is limping child. So we have seen a lot of children who are limping, who are limping. So what is the causes of limping? Let's understand. Because it is asked when you go for a viva and you use the words like limping, so the teacher is going to ask you, okay, what are the differential diagnosis of a child who is limping? So the mnemonic is Dr. Antic, if you can remember, Dr. Antic. So Dr. Antic, D for developmental, so developmental dysplasia of hip, developmental dysplasia of hip, and some people with having the limb length discrepancies. So what actually limp means, say limping is actually meaning that one side of the leg the child is going to raise and is going to bend to the other side. This is actually limping. So developmental dysplasia of hip is one thing, limb length discrepancy. Then in some rheumatological conditions like juvenile idiopathic arthritis or rheumatoid arthritis, of course acquired conditions like rickets, where you have got the bow-shaped legs. So in them also you are going to have the limping. Then you have neoplastic diseases like some neuroblastomas, some leukemias, bone tumors, everything, because neuroblastoma has got nerve involvement as well as bone involvement. Then some neuromuscular disease that is called as cerebral palsy, cerebral palsy, in fact the polio also. Then traumatic like fractures and soft tissue injuries, and infections like osteomyelitis, septic arthritis, TB, all these things. And congenitally, if the patient is having club foot, congenitally if the patient is complaining of club foot. So these are different type of conditions where the child will have a limping gait, limp. So just remember that there are different types of gaits depending upon the limp. So depending upon the condition of the patient, like one is called as antalgic gait. Now what do you mean by antalgic gait? See, mostly in the pathological fractures, infections. So what is going to happen? The child, the patient tries to avoid putting weight on the side which is affected, and that is called as antalgic gait. So can you understand? See, this hip is actually under pain. So this hip is actually under pain. So that's why just patient avoids to put weight. That is why can you see this foot is in air only. So he walks with this side, and then the pain is not there on the other side, on the left side. Coming on to the Trendelenburg gait, this is important and has been asked as a previous year question also. So what do you mean by Trendelenburg gait? So please understand, can you see that this side of gluteus muscles are weak? This sides of gluteus muscles are weak. So what happens? See, the normal function of the gluteus muscle of both the sides, like for example, if I tell you that let me give you an example over here only. If both the gluteus are working, then the patient will have this line. If for example this side gluteus is not strong, so this side gluteus is going to pull the weight, and the patient will have like this gait. So what is going to happen? The drop is going to be there, drop of pelvis is going to be there when lifting the leg opposite to the weak gluteus medius muscle. So you will lift it, and the patient is, so once you are going to lift it, so every sara ka sara jo weight hai, every single bit of the kgs of the weight is going to come on here, and the muscle of this side is going to pull the other side, and once the pull is generated, there will be a drooping or dropping of pelvis which will be seen. So why it is there? Because of the abductor weakness. So can you see what do you mean by abductor? So abductor means that's going to pull it like this. Now because it is not working, the movement is in the opposite direction. This is the Trendelenburg test. So yeah, so next is going to be the other neurological causes like spinal cord issues. Then you have got peripheral nerve problems, and then you have got non-skeletal mimic. Now it's not the skeletal issue, it's not properly the bone issue, muscle issue, but for example, if the patient is having appendicitis, the patient will have a referred pain, okay, around the hip, okay. Or if the patient is having testicular torsion, the patient is going to have the pelvic pain. So the child, the patient is not going to exert pressure over there, and of course, the pressure will be taken on the other side. So that is a mimic only, but that's not the true cause of the limping. There's one more mnemonic. Mnemonic says LAD in shorts. So L for leg calf Perthes disease. This is important. Please remember that Perthes disease is something which is having a limp, okay, which is having a limp. Then acute rheumatic fever, I have told you. Developmental dysplasia, I have told you. Then SCFE is also the one which is going to present with the limp. What is SCFE? Slipped capital femoral epiphysis. Slipped capital femoral epiphysis. Coming on to H, henoch-Nollin purpura. Yes, purpura is also going to have this issue. Then you have got osteomyelitis, rheumatoid arthritis, synovitis, tuberculosis, arthritis. So every itis is going to have the pain, and of course the child is going to present with the limp. Okay. So this is all about the differential diagnosis of the child with the limping, and thank you so much for watching. God bless you.